Good afternoon, everyone. We are Team SafeStride, and we are delighted to be spending this weekend creating insight-driven safety for every step. This weekend we have tackled a £2 billion problem for the NHS, which is that of a risk of falls. There are many patients within our healthcare systems who are at risk of falls. Patients with dementia, elderly patients, patients with Parkinson's, or living with chronic healthcare conditions. But more than that, we do know that there is a high percentage of people who have carers and family members that support them, and there is a lot of opportunity and a lot of challenges placed on carers that often go unrecognised. But we have decided to develop a piece of technology that supports people's well-being, welfare, quality of life. Importantly, that's peace of mind as well, that carers can see from a distance some of the challenges that their loved one might face, both at home, but also this platform designed to support care staff within nursing homes or care facilities. One of the things that we have done here, and that makes our presentation novel and really different to what is currently out there, is that we have taken data from multiple data sources and data inputs, which is not something that is currently on the market. We are using things from electronic health records, from nursing records, or scraping data from there, but also other ambient technologies, smart watches, and bringing that all together, but importantly, making meaning and making sense out of that so that we can place projected risk or get patients risk stratified into different categories so that they can have tailored interventions to support them, both taking out background history and patient-related data so that then we can tailor something that supports them if they are dehydrated or have malnutrition that supports them. But current risk stratification is both static at times, it's both labour intensive then for staff to be able to measure that and to intervene. I'm going to hand over to Simon, who is going to share about a platform we built this weekend.
Thank you. So what we've done to imagine this is we've set this in a care home setting, and what you can see here is like our amazing dashboard, and you'll see someone is sat down, my colleague is sat down over there, and now he's walking. And so what our system does is it takes a number of inputs, and these could be Internet of Things, mobile phones, patient care records from the NHS, and converts that into a risk that you see here. And this is a dynamic risk of whether a patient is going to fall or have an accident. And actually you see we've actually fallen over. And now we can go and use that to give very quick care to the person who's fallen over. So if you imagine yourself in a care home setting, that you can then get to that person very, very quickly. You could also be a son or daughter who's very concerned about their elderly parents and can get to their house so they're not lying on the floor helpless for a long, long period of time. And what you see here is then we give the caregiver some contextual information of what's going on. So this person has a UTI, so that gives them a very high risk of falling, and we've all the other kind of information that may be useful for the care person.
Thank you so much. And just to wrap up, we have had a fantastic weekend learning from each other. We are a group based of clinicians and software engineers, and we've come together to really create a piece of technology for a group of people that are often overlooked. Technology is not often designed with the elderly person in mind, nor is it designed for carers in mind. So this is something that we think is both relatable, both acceptable for people out there facing real life challenges, and we are really pleased with what we have created. So thank you very much.
So folks, that's how you deliver a presentation in 4 minutes. Now we're going to start with some questions. Does anybody have any questions? And I'll try and get you a mic. Any of the judges first up?
So you've got the information on the screen. If you're a carer or in the care home or at home, how would I know how to access that information?
This can be delivered in a variety of ways. So our system, we built it quite, I think we built this quite cleverly. So this is very modular, so we can have any range of inputs and any range of outputs. So in a care home setting, this might be a pager that could alert them, or if you're a parent, or no, sorry, if you're a child, this could be a mobile app which pings you with an alert. So we've deliberately made the inputs and outputs very generic, so we can deliver the alerts however we need to.
Any other questions?
just interested, so you've got this prototype, what's your next steps? What are you going to do next?
Yeah, so there are so many possibilities with this. So that what we have demoed today was with the technology that we had available this weekend, which was a smartphone or smartwatch. But there are lots of different ways that we can get some data, so that we can connect that with other things such as sensors, motion sensors, cameras, for sleep detectors, sleep mats, and bring that in, so that actually then we're getting more and more data to have it more and more personalised and specific. But equally then how we connect this with other groups of patients, so people with different chronic health conditions, also people at risks of falls, moving out into patients' own home for self-management purposes, which is a massive move now. But also, as Simon said, those connective outputs as well. So how can we reduce the burden on human intervention always for care staff? Can we connect this to an ambient light? So a light turns on in the living room if we recognise that as a risk, or an Alexa can play some music or give someone a prompt, to get up, if being sedentary is a risk to their fall, to get up and move every 30 seconds. So that technological, but also human and population based.
Any up?
Have you thought about the impact of false positives on health system capacity?
We've only got 30 seconds left. You're going to give this question.
Yes, yes, absolutely. And one of our biggest things then is about self-management, but giving this back to patient and carers, because exactly that, we are very mindful of designing this that it doesn't add burden to staff, but it thinks about risk stratification across categories, prioritisation of care. But really, where we would like this to go is for being able to manage at home with people in the house with care staff. Yeah.
That's great. I'm sorry that's my 3 minutes up for my question.